Good afternoon, everybody. I'm Dr. Sanmay Choudhary, working as an intensivist and physician at Ruby Clinic, Main, Road, Pune. And this is basically a very burning topic at present with the rising resistance patterns seen across all platforms in our clinical medicine. We often face this problem of antimicrobial resistance, primarily due to less knowledge and less awareness of the basic cause of infection. Second, of indiscriminate use of antibiotics over the counter, which are prescribed and often inappropriately prescribed and appropriately used in wrong doses and duration. So one must be very clear that once you are using any form of antibiotic, we are basically antagonizing the nature in the form of the basic way of healing and not giving that much adequate time for the body to respond to the infection, whatever we have in our body. So any form of infection, any form of insult to the body first must be given adequate time to heal on its own. It could be first 24 hours or say first 48 hours, where often bacterial infection is there. It is often in most cases, it is viral. And in such cases, antibiotics should not be the first drug of choice. We should be giving adequate time for the body to respond to the type of infection that we got, especially when it is a viral infection. And in such cases, antibiotics should not be prescribed. They should be reserved. In cases where we suspect, yes, there's a definite focus, we try to identify the focus, we try to clear the source of infection at the best with the appropriate antibiotic, which is enough to kill that particular site of infection. So one must be very thoughtful before prescribing, or even doctors who prescribe antibiotics on prescription, unless and otherwise very much required. Localization of infection, identification of infection, and adequate source control is the key to prevent antimicrobial resistance. It is our duty for the society to prevent over-the-counter antimicrobial prescriptions and also to prevent from the community more rising resistant infections which are difficult to treat. As of now, in our scientific basket, we have very few antibiotics which have been reserved for future generation. There are hardly any antibiotics left, with having pan-resistance almost all antibiotics that are available. We face that problem in the tertiary sector because as patient comes to us, he has already received multiple antibiotics, and we find it very difficult to give him any antibiotic to clear him out of the acute process. We